Today on this episode of The Crossover, we will be discussing the road to becoming a plastic surgeon with award-winning plastic surgeon and best-selling author, Dr. Richard Brown. Learn about the time, energy, and dedication necessary to enter one of the most competitive medical fields possible. Much more on this episode of The Crossover. Good afternoon, everyone. I'm going to be talking with my friend and colleague, Dr. Ricky Brown, about what it takes to become a plastic surgeon. Hey, Ricky, what's going on, man? How's everything?
I'm good, man. How are you doing?
I'm doing all right. Thanks
From
for
one Ricardo to the other.
There you go. Or Rick to Rick, or Rick to Ricky, or however you want to do it.
Yeah, Ricky's good for me.
Yeah.
But, I get called Ricardo every now and then, so.
Yeah, exactly. Same here. It's either Ricardo or Rick, but whatever works, right? Listen, I'm just going to do a brief introduction while we have everyone logging on. We have the pleasure of speaking with my friend and colleague today, Dr. Ricky Brown. He is an award-winning plastic surgeon and best-selling author. Absolutely. As background, Ricky is double board certified and received his undergraduate degree from the University of Georgia. Congrats on the national championship.
Thank you, sir.
His medical degree from the Chicago Medical School. He did his general surgery residency at Northwestern and then plastic surgery residency in Nebraska. He founded his own practice, Brown Plastic Surgery, in 2009, and has since taken off as a nationally recognized leader in the field. In addition to being a very skilled surgeon, he's also author of the best-selling book, The Real Beauty Bible, Navigating Your Journey Through Plastic Surgery. And we're here to discuss how he became a plastic surgeon, why his story is a little bit unconventional, and what he recommends for other people who are trying to follow in his footsteps. So very excited to have you on, Ricky, and excited to talk to you about your journey.
Thanks, man. I appreciate it. You are well established yourself, man. All those Ivy League schools and that training. We need you, bro. It's awesome.
Well, listen, it's a pleasure, and we'll just jump into it. When did you first decide to become a plastic surgeon?
So plastic surgery was something I became interested in during my general surgery training. So when we were doing, trauma, mostly heavily trauma trained in Chicago, I did most of my trauma training at Mount Sinai in Chicago. And so I got to kind of see a lot of really crazy traumatic injuries, and the plastics guys would kind of come over and do the reconstructive work. And so part of the way through my training in general surgery, I was like, wow, this stuff is really intriguing and interesting to me. And in the middle of all of that, a couple of the plastics residents from Northwestern, when I was over at Mount Sinai, they would rotate through our trauma program. And they were like, hey, man, you should go in the lab with us next year. We're going to be doing some research on wound healing and scarring. And I was like, hey, let's do that. So in the middle of that whole process, I just really got intrigued by the field, and that's what drew me in.
Give us a little background for people who may not be familiar, but what type of schooling and training is necessary to become a plastic surgeon?
So we get your bachelor's of science, just like we all do, right, to apply to medical school, take all the pre-med classes. So we do the standard 4 years for there. Mine was 5 because I just decided my senior year of college. After that, 4 years of med school. And then once I finished medical school, there's a couple of different ways you can go for plastics. Some people go into the combined programs, and that's when you know that you want to go into plastics. And so you can apply to go straight into a 6-year program. And on that 6-year program, you generally do 3 years of kind of the basic surgical experiences like we do in general surgery, and then you kind of parlay into your plastics training. Or the other way you could do it is the way that I did it. And I actually started general surgery because I didn't know what I wanted to do, but I just knew that I wanted to be a surgeon. And so you can finish your surgical residency, and it could be ENT, orthopedics. Like I trained with a guy in plastic surgery who was orthopedic trained. As long as you finish your surgical training, you could then apply for an additional 2 years. And now it's 3. At the time that I did it was 2 more. So I did a 2-year residency after general surgery to get to plastic. So it was 12 years total for me.
Now, when everyone hears plastic surgery, the immediate thought is cosmetics. But we all know that there's so many other divisions of plastic surgery. Can you take us through what other types of plastic surgery there are?
Absolutely. And I love that you're bringing this up because I think it's a big issue in the world today that, that all we see is the cosmetic stuff. And I always try to tell people, what you guys don't realize is we're the ones doing breast cancer reconstruction after mastectomy. We're the ones fixing cleft lips and cleft palates, and sewing up faces that are traumatically injured in car accidents. And we get to do anything from that kind of reconstruction to helping guys like you in neurosurgery when skull caps come off and we have to do cranial vault reconstructions. And the other thing is the microsurgery aspect, which I think is a huge aspect that people really will never appreciate in our field. And that is where, we'll take someone who's got a huge chunk of tissue missing from one part of the body from a cancer reconstruction or just from a traumatic injury, and we'll take it with an artery and a vein and move it to another part of the body. And under the microscope, we sew arteries and veins together to bring life back to that tissue. So it's really kind of an intriguing field. I think that's what grabbed me about it, was that I was interested in the fact that I could operate on young children to older adults. There's something in plastic surgery, reconstructively or cosmetically, at all age groups, which is pretty interesting.
Yeah, I think plastic surgery goes so far beyond just cosmetics, and it's important that people realize that. And even though that's what's in the media, there's a lot of deeper kind of parts of plastic surgery that I think are just as important, if not more important. And it's great to kind of raise awareness about that. Now, your road to plastic surgery was a little bit unconventional. Can you just go into that a little bit?
Yeah. So I sort of alluded to this in the beginning. I didn't know that I wanted to be a doctor from day one. So I was milling my way through college, just not really knowing what I wanted to do. My parents actually owned a computer company, ironically selling computers to medical practices back in the 80s. My parents were like automating offices for all the appointment scheduling and all of the financial reports and things like that. It wasn't EMR. So I just kind of thought I was going to go work for my dad. I didn't really have a desire to do anything, but I'd always been a very handy guy. Struggled in school a little bit early on. I think a lot of that in hindsight was more about not having something that I was really passionate about and wanted to do. So I had mediocre grades. I mean, I was like, I had a 2.6 when I decided to apply to medical school. And so what happened for me was at a pushback moment at Georgia when I was studying for an economics test. And I was like, man, I just don't think that I can do supply and demand curves and all of this stuff for the rest of my life. And I don't think at that time I appreciated the fact that that's not what all of business is. But something in my brain told me like that path just didn't seem like what was going to fulfill me. And so then I started thinking about what could I do, maybe something in healthcare, because I grew up around doctors. I was always intrigued by what they did because of my parents' business. And I just volunteered at a hospital. I was a patient transporter. I moved patients around the hospital while I was in college. And I started to develop this discussion with patients and getting to know them and feeling like I was a part of their journey, even though I was a transporter. So after I decided, after I did that, I said, maybe I'll do something in science and something in medicine. And one thing led to another, and I decided to go to medical school. And so I'm a senior in college at the University of Georgia, the year that the Olympics were there in '96. And I just start cranking through my pre-meds. I started by just taking a couple of science classes, and I got A's in basic chemistry without even really working that hard. So my brain started to turn like, okay, this is my jam, man. Like, I'm not stupid. Now I have a target. So I was told by my pre-med advisor at Georgia that I would never get in. He was like, you're a long shot. You're never going to get in. And I'm the kind of guy that's sort of like, the best way to get me to do something is to tell me that I can't do it. And that kind of drove me. I mean, I still would have gone as hard as I did had he not said that to me, but that really drove me to do well. And I ended up with almost a 4. I had a 3.8 science GPA, which brought my overall GPA up. So I applied. I worked in the operating room in Atlanta for 1 year after I applied to med school and took the MCAT. Got a decently competitive score. At that time we were on the old scoring system. And that's where I fell in love with surgery. So I was an orderly in the OR, just mopping floors and wiping down tables. And I kind of found myself ducking into the neurosurgery room, into the heart room, watching surgery, and just fell in love with that. And so that was the beginning of my journey. And I was lucky enough to get accepted that year that I was working. And so I matriculated to med school when I was 27, which for all intents and purposes in our world is really late to start medical school.
And so, I guess people would wonder, plastic surgery is so competitive at every level. How did you get your edge?
Oh, man, I think everyone has a story, and I'm not really sure it was an edge as much as I wasn't accepting no for an answer, right? So I just decided this is what I wanted to do, and I positioned myself in every way that I could, meaning I worked really hard as a general surgery resident. When I was in that plastic surgery lab, I wrote papers. I worked really hard. I made connections with people who could potentially write letters for me and help me get to where I wanted to be. I think part of it was just being really a little bit ignorant to how difficult it was going to be, and more just, this is what I'm doing, and whatever I have to do to get there is what I'm going to do. And so every rotation I was on that I could make friends with anyone, it didn't have to be plastic surgeons, but anything I could do to give myself the edge, I did. And, one of the things that I think was really is something that comes natural to me is it's easy for me, as you see, to just talk and be authentic and real in who I am. And I think what really helped me when I went to go interview for plastic surgery was I was relatable. I was not just telling them what they wanted to hear. I was telling them my story and why I really wanted to become a plastic surgeon. And, some of it I would say is luck, but I always tell people I don't believe in luck. I think the harder you work, the more fortunate things that happen to you. And so what I would tell anyone in my position is don't be fake and don't tell them what they want to hear. Just be who you are and tell them why you want to do what you want to do, and let the chips fall where they fall.
That's really well said. I feel like personality, bedside manner, being able to be real, authentic goes so far, and you're clearly an example of that. Now, you went through the decision that I guess everyone graduating medical school and residency has to go through. Academics versus private practice, pros and cons to each. I'm sure you had options to do both. Tell us your decision to pick private practice. Were you torn at all? What made you go private over academics?
I was moderately torn before I got there. When I was at Northwestern, all that bench work we did kind of showed me like, I really enjoy this, but I don't think that this is where I want to be for the rest of my life. I think because I am so authentic and relatable and have that natural bedside manner, it seemed more natural to me to get out and create my own practice, to treat patients the way that I wanted to be treated. I didn't want to be held down by, the corporate America of the hospital system, where social media, for example, right? Really difficult to kind of be who you really want to be on social media because the hospital is so limiting. Now, social media wasn't a big thing at that time, but my point is, I wanted to be able to craft my journey and treat patients and create the patient experience that I wanted my way. And I wanted to run a company. I've got that entrepreneurial spirit, and I sort of like the edge of not just being doctor, but figuring out how to grow something that's meaningful and really has value.
I think that's well said. I think there's less protection in private practice because in academia, you are surrounded in that university setting, so you're more protected. But like you said, in private practice, even in neurosurgery, more freedom to do what you want to do, less oversight, and that kind of played towards your strengths. What would you say is the most challenging part of your job?
Believe it or not, it's the business stuff, right? Like we all as surgeons, we're always learning, but by now we've both been in practice long enough that when we go into surgery, we have a plan, we have the technical skill and the acumen to do what we need to do to get the job done. So while in the beginning it might have been the physical part of doing surgery, I would say more so now it's running a practice, being a business person, understanding, what it takes to motivate employees. How do you generate good income and run a practice at a minimal overhead without, swamping all of the money that you can take home to make? So I think just being a business person is by far the hardest part.
What do you think is the most gratifying part of your job?
Without a doubt, making patients happy and taking care of them. For me, there is nothing better or more uplifting when I have a patient crying in my office about how I've changed their life, right? And that could be reconstructive or cosmetic. To me, there is nothing better than just seeing people happy. When people tell me like, oh my God, you're the best surgeon, you've changed my life, I think like, talking to me? Like I look over my shoulder, right? Like I'm a pretty humble guy. I'm good at what I do, but to me, I'm like, I'm just doing my job. Like I'm not doing anything that's difficult. And when they tell me that, I really, really take to heart and I receive what they say. But to me, I'm sure you get this too. My thought in my brain is, I'm just doing what I love to do. And I'm so glad that I could be a part of your journey to make you happy in life.
I love hearing your enthusiasm for your job because I think especially surgeons, the vast majority of us have such a passion for what we do, whether it's plastic surgery, neurosurgery, any type of surgery, that I tell people I never worked a day in my life. Every day is fun and you're doing something that's so rewarding. So I couldn't echo what you just said more strongly. What do you think is the number one most important factor in becoming a world-class plastic surgeon?
You know, I'm going to come back to the same thing that I said a second ago, and I think this goes for anyone who's going to be a doctor in general and do anything. So I think this relates to not just plastic surgery, but number one, it's authenticity, right? You have got to have a love for the patient at the forefront of everything that you do in medicine. And it doesn't matter what you're doing. If you don't authentically feel passionate about helping people, you're never going to survive. When it comes to plastic surgery, I mean, you obviously have to be skilled, right? You got to be a skilled surgeon, and you sort of have to be a psychologist at the same time. And I will tell you, that's probably one of the things in plastic surgery that's really, really important, is for people to understand that you're dealing with personalities and body image stuff. And if you don't know how to appropriately handle people and talk to them, you're going to fail. So I think if you can be successful and really being able to handle people from that perspective, you could be really successful at it.
Let's talk about something that's very big for your practice, and that's social media. How important is social media to your brand? You've created an enormous brand for yourself and your company. What role does social media play in that?
It's played a huge role, and it was by accident. When I started to get on social media, and it's obviously grown and changed in many ways what I present on social media compared to what I used to. It's really, to be honest with you, it has given me the ability to connect with people and show them my family life, to show them my business life, to show them my fitness life. They get to see all aspects of me, so that when they come into the office to see me, I get this all the time. People are like, wow, you are like, I feel like I already know you because I watch you all the time on social media. So from the perspective of branding, it's unintentional because I'm always giving information, and I never ask for anything back. I don't sell anything. I don't have any products to sell. So I think that the fact that I have grown this educational platform has just led into people feel comfortable when they come to see me. And I think that is probably the biggest thing that you can do for people, is to give information, give 10 times in value what you want to receive back. And people feel that and they see that.
Now, you have an incredibly large following. What was the key to you generating such a large following?
I don't think there's any magic to it other than just producing good content. And if you watch me, you'll see, and you have seen, I don't always post about plastic surgery. I have a love for medicine. So if I see something I want to talk about that's on TikTok or on Instagram that's just medical that I can add value to, then I do that. I do some comedy because it's fun to make people laugh. So my goal is to educate, entertain, and inspire people, and I show fitness stuff. So for me, it's just been a mix of all of those things, and being able to show people all of those things that has been really valuable. And the following just happens, right? Like if you are authentically creating content, you sort of see through the metrics, what do people like to see? What do they not like to see? And I try to gravitate towards the posts that people like to see.
I think that's, everyone who has a big social media following like yourself, every one of those people I've asked all say the same thing. You got to be authentic. You have to post regularly. You can't post like once a month and expect people to follow you. So
Right.
Educate people, be authentic, and post regularly is kind of what everyone says are the big keys, just like you reiterated.
And I think not being salesy, right?
Yeah.
Like you can't be salesy. You can't always have a pitch for a product or something that you want them to buy. That's where people, I think, really go down the tubes a lot.
Correct. Once it becomes truly self-serving, people identify that and then they just back off. I totally agree with that.
Yeah.
You're young. You're already at the top of your field. Kind of, what's your next goal and challenge? Do you have something that you're aspiring to do?
Absolutely. So I'm a young 52, believe it or not. So you're talking business-wise and life-wise. So business-wise, absolutely. So I've got this concept that I'm really, really intrigued about, that I'm trying to bring into my practice and hopefully start as a wellness center concept, where I want people to be able to come into my office, and if they're not physically ready to have surgery to obtain a good result cosmetically, a lot of people struggle with the meal plan. They struggle with the mental health side of body image. They struggle with what foods to make and how to be healthy. So I have this wellness center concept where I have already a mental health specialist in my practice. I've got a macronutrient coach. So if I identify patients who are struggling from the perspective of getting their body where they want to be lifestyle-wise, my philosophy is plastic surgery should be your last resort. Changing your lifestyle should be the first thing you do. And so I really, really passionately want to bring people on this journey where if they're not ready for surgery, I can funnel them down this lifestyle plan to help them mentally get better, help them physically get better, which leads to a lot of other aspects in their life. So my goal is to grow that concept and really try to bring that either to many practices or in my town to have places around town that offer those services.
That's brilliant. I mean, just like you said, people think of plastic surgery and it's just the surgery, but that's like the easiest part of the whole journey. It's all the psychological, all of that goes into it, understanding the person and the entire holistic wellness around that procedure. Is there any other place in the country doing that?
To be honest with you, no, there's not. I actually trademarked a company already called INBE, INBE, kind of like in between your journey. And I've been working on this concept for a couple of years, and we're just really trying to figure out how do we bring this to life on a large scale. And we've just been testing it in my practice for like a year now. I've been funneling people to my friend Megan, who's a nurse practitioner who's done, well, she's done a lot of macronutrient coaching for years, and we kind of send patients to her to work with, and then they come back to me. And what's beautiful about that process is people are really, really, really changing their lifestyle, which allows them to then maybe not have surgery. And if they do have surgery, maintain those results without rebounding a year later and feeling sorry about having gained 20 pounds again. So it's something that we've tested, and we're pretty close to trying to maybe try to launch it on a bigger scale.
Super cool. Can't wait to hear more about that. That's got a lot of potential. If you could go back in time, do it all over again, what would you do differently, if anything?
I would say for me, and I know everyone's cliche answer is I wouldn't change anything. I think I would change a little bit of one thing. I probably would have paid attention to school a little bit better in the beginning because it was really stressful having the GPA that I had, knowing the dream that I had, and I wanted to get there. And this easily could have been a no. I could easily not be sitting in front of you right now. There are plenty of people who don't get in who have 4.0s. And so I will say that I wish I had taken school a little bit more seriously in the beginning. And that's really all I could tell you, because everything else that's happened is just for a reason. And I feel like it's part of the journey. But that's really the one big thing that I would say, just to try to not have had to stress about test taking and the grades.
I mean, at the same time, you could say that situation kind of created who you are. So
100%.
While it makes sense to do it over again and maybe not be as stressed, I feel like that underdog mentality kind of put that chip on your shoulder, and that's kind of where you are now. That's just
100%.
devil's advocate.
Yep, totally, 100%. I mean, there's no question that when you're up against the wall and you have nowhere to go but forward, you figure out a way to do it. And that's exactly how I felt. I mean, I felt like I was up against a wall. I was competing against people who were magna cum laude, 4.0, big dog academic people. And here I am, little guy from Georgia, trying to like get into plastic surgery and surgery. And it all happened, you know?
Well, I mean, I tell people who are in college and they're like, I can't do organic chemistry, I can't be a doctor. I always tell them those are just hoops to jump through. And let me tell you how many times I use organic chemistry on a daily basis. That's zero. So,
Zero.
Those are just, like no matter how hard the road is, those are hoops to jump through, and you just got to get through it in order to achieve your goal. And so I think your story is incredibly inspirational. Now, give us your crystal ball view in terms of changes that you see in plastic surgery over the next 5 and 10 years.
God, that is a great question. Technology hopefully will play a big role in it. Changes that I think I can see in the next 10 years. I'll tell you one thing that I would like to see. I'd like to see a little bit more of a virtual experience where people, it's really hard to get into offices. It's really hard to get information. What I would like to see in the next 5 years is, number one, for the information highway to be easier for patients and have it accessible to all the people that want to do it. It shouldn't just be a rich person's, the cosmetic stuff. The other thing I would like to see is, what was I going to say? There was something on my mind besides the education side. I would like to see a little bit more of the crackdown on these non-board certified surgeons being able to do all of these procedures that are harming people in strip malls and all of that. And I really, really am hoping to see a little bit of light shed on how we can sort of reverse that, because that is a huge problem in our country. not only in our country, but people are forced to go out of the country and the same thing happens to them. I just want to see people not get hurt. And that's a huge issue.
What an interesting point you brought up, because we have the same thing in neurosurgery. You've got people who graduate from another country or even graduate here from the US, and they don't get board certified because they're not safe, but they can still practice. And there's a lot of people that are getting hurt by non-board certified surgeons. And so I agree with you. Having some kind of quality control or better quality control would go a long way. Yeah, we're gonna say something.
I was gonna say, I don't understand it. Like what I have a hard time figuring out is why the medical boards don't crack down on it. What is it, a political something that I just don't understand? They're afraid to tell certain doctors they can and can't do certain things. I mean, look, I'm not going to go do open heart surgery, but I probably could make my way through cracking a chest and exposing the heart, but no one wants me to do that on them because they probably wouldn't make it. You know, the same thing holds true for our specialties. Like, I don't understand why the boards just don't come down on that situation.
I suspect there's a lot of politics, just like in everything else in this country. It's all politics, and people kind of lose sight of what's important, and that's patient safety.
Yeah.
You know, wrapping up, because I know you're super busy, what would be your advice to anyone listening who wants to become a plastic surgeon?
I would tell people that, number one, it is not about the money. If it's ever about the money for you, it's a problem. You know, that is one thing that I would tell you, because you get a lot of young kids that message me and DM me that they want to be like me and they want to be a plastic surgeon, and that's their dream. I think this is piggybacking off what we just talked about trying to keep people safe. You've got to have authenticity at the forefront of what you're doing. If you do not truly enjoy the craft of plastic surgery, you're never going to make it. And so what I really would tell people is to really sit back and evaluate yourself. It is not all about boob jobs and Botox and Juvederm. That is not what gives me huge joy in the world. It does, because it helps people. But the things that are really going to bring you joy is the deep-rooted skill of plastic surgery, and that is reconstructive and cosmetic. I don't think I could ever just be cosmetic and just be reconstructive. I do a little bit of a mix of both. And if you're not passionate about actually doing plastic surgery, I think you're going to fail miserably, because if you're only in it for the money, it really just exudes from you in practice, and people feel that, and they're not going to gravitate towards you.
Listen, I'm going to wrap up here, but I think there's 2 points to this interview that I loved. I think number one is the fact that you love your job. And I think this goes so far outside of medicine, but I tell anyone, if you're going to be successful, if you're going to be the best at what you do, you got to love it. Talent only takes you so far. You got to have the work ethic, and you got to be passionate about what you do. So hearing the way that you love your job, just the way I do, really inspires me. And so I certainly support that. And then number two is the fact that you made up your mind about what you want to do. You weren't going to take no from anyone. You weren't going to listen to the critics, and you just got it done with your unconventional way of getting to medical school, residency. And now that authenticity and that work ethic has elevated you to the top of your field. So very impressive, very inspirational. I think anyone listening should understand it's about passion, it's about work ethic, and it's about focus. And you kind of epitomize all three of those.
I appreciate that, man. I have a question for you, actually. It's a neurosurgery question. What's your thoughts on tumor treating fields?
I would say it's typically a last resort option for malignant tumors. Some people use it as a frontline therapy. There's not much good data on that. Currently, our medical center, and I think most academic centers, use it as a salvage effort if the tumor comes back and you're out of options.
Yeah, pretty cool stuff. I've read a little bit about it and seen some about it. When I knew that I was going to get on here with you, I was like, man, I need to ask him his opinion about tumor treating fields.
Absolutely.
I was
going to wonder. It's a very random question, but I think it's very pertinent, because that might be the future of treating malignant tumors. It just depends on kind of improving that technology a bit.
Yeah, pretty interesting stuff. Cool.
Always. Well, listen, man, thank you so much for joining us. Have a great rest of the day, and I really appreciate your time.
I appreciate you. Thank you so much.
All right, Ricky. Talk soon, bud.
All right, I'll talk to you.
Later.